Okay, so I'm talking about female reproductive cancers. I'm going to share my screen so you can see what I'm talking about. And these are the main cancers of the female reproductive system. There's a lot more, but we're going to focus on these. We'll focus on cervical, ovarian, endometrial, and vulvar. So cervical cancer, the main risk factor for cervical cancer is HPV infection. Smoking and oral contraceptive use are also related to cervical cancer, but the primary source of cervical cancer is an HPV infection, and specific types of HPV are associated with that. Ovarian cancer is the 5th leading cause of death from cancer in the United States. The main risk factor for having ovarian cancer is that BRCA gene and not having any pregnancies. Endometrial cancer, uterine cancer, the main risk factor for that is exposure to estrogen via oral contraceptives, obesity, and smoking. Vulvar cancer, the vulva is part of the perianal area, and the main risk factor for that is age, hypertension, being under immunosuppression, and diabetes mellitus. Manifestations of these sorts of cancers include pelvic pain and bloating, especially with cervical, ovarian, and endometrial cancer. Painful urination with ovarian and endometrial cancer happens as well. There is a lot of perianal pain with vulvar cancer and unusual bleeding. So there are times where people who have cervical cancer will have bleeding after intercourse. There will be times with people who have endometrial cancer, like they will go through menopause and then they will start bleeding again. And that is a sign of endometrial cancer. There's also menstrual changes in ovarian cancer where you may have periods more frequently, and there may be periods less frequently. So the typical ovulation cycle or a typical period usually comes about once every 4 weeks, about every 28 days. And so with these other cancers, you can have either less frequent than that, so maybe a period every 5, 6, 8 weeks, or more frequent than that, even like 2 or 3 weeks. And all the girls in the room just went oofta. All right. So nursing process associated with this. There are some different screenings and tests that we're going to be encouraging people to get. Physical exams, pap smears, HPV tests, genetic testing for people with a family history of BRCA, colposcopy, not colonoscopy. Colonoscopy is where we do a camera exam of the colon. Colposcopy is where we do a visual exam of the cervix, and then we can use biopsy. This particular picture here is taken through a speculum, and it is picturing cervical cancer. So you're aware. The nursing diagnoses associated with any of the diagnoses that I've talked about, whether it is cancerous or non-cancerous, include anxiety, acute pain, disturbed body image, and impaired sexual functioning. When it comes to planning, we really do need the client to be on board with what's going on. They need to be actively taking part in treatment decisions, as well as we're going to be planning some pain and symptom management. What we need to teach the client about recognizing and reporting different problems, allowing, manifesting that client to get to their preferred lifestyle, and then also practicing cancer detection strategies. Nursing implementation associated with this particular set of interventions is a little bit complex. So I'm going to talk about this slide and health promotion, and then I'm going to be moving into the different types of surgeries that we work with clients through. So for health promotion, we'll be teaching the women the importance of routine screening and how it can reveal precancerous conditions. If we can catch a small tumor on a cervix before it becomes cancer, that would be amazing. Teaching about reducing lifestyle factors, the importance of limiting sexual activity during adolescence, using condoms, fewer sexual partners, and not smoking, as well as assisting in changing lifestyles as well. We may need to do acute intervention with surgery, depending upon what's going on. Whenever we're working with people on reproductive problems, I just anticipate we're going to have anxiety, because reproduction can be really tied into a person's self-esteem, whether they're going to be a parent, whether that's going to be one of their future life goals or not. A discussion of feelings and concerns is incredibly important, as well as looking at each patient individually. Some people may not want to have children. Some people may not want to reproduce and have their own, have their genetically, biologically own children. Maybe they are much more inclined to adoption, or maybe they're inclined to not have kids at all. So having those conversations so that we can treat each individual patient as their own holistic self is incredibly important. There are some different standard preoperative preparations that can be occurring, including we may have them do a vaginal douching, which would remove extra cells and material out of the vagina. We may have to have an enema, which would help them evacuate their bowels. An empty bladder is really important, so important that they may have an indwelling catheter to keep that bladder empty while things are being surgically intervened on. I'm going to stop sharing here, and I'm going to pause the recording, and I'm going to record the surgical interventions for female reproductive problems in just a moment.